We'll go with the urogenital triangle. So urogenital triangle, the boundaries are anteriorly you have the lower border pubic symphysis with the inferior arcuate ligament, and posteriorly an imaginary line joining the two ischial tuberosities. On either side you have the conjoint ischiopubic rami. If you observe here, this is the ischiopubic rami on the lateral side. Anteriorly this is the pubic symphysis lower border, and these are the two ischial tuberosities. So an imaginary line joining these two from here to here, this forms a triangle, urogenital triangle here. If you go deeply further, we have taken out the skin, we have given incision, skin, and then deep to that is the superficial fascia. Here, you know that in the abdomen, superficial fascia is having two layers called as superficial fatty layer and deep membranous layer. Deep membranous layer is called, in the perineum we call them as the Colles fascia. So this Colles fascia, it further, when we trace it upwards, it continues as the fascia of the scrotum, we call it as the dartus muscle, and continues as the fascia of the penis, and continuation of the fascia of the abdominal wall, anterior abdominal wall. Here we call in the anterior abdominal wall the same fascia, we call it as the fascia scarpa. So this continues above towards the abdomen. So deep fascia, we don't have deep fascia here. So superficial fascia is having two layers, superficial fatty and deep membranous layer. Deep membranous layer is also called as the Colles fascia. Here you can see this is the Colles fascia, and we have entered into the pouch actually. That is why I have taken out the Colles fascia. If you observe here, if I pass a probe, it goes upwards towards the fascia of the scrotum, also called as the dartus muscle. So this is a superficial deep membranous layer of the superficial fascia. And if you further go down, we have another membrane called as the perineal membrane. So this perineal membrane is nothing but deep to this superficial fascia, you have urogenital diaphragm. Urogenital diaphragm means any diaphragm if you take, this is containing one muscle and it is covered by two layers. So the muscle is covered by two layers. So inferior layer of the urogenital diaphragm, and this is called as the superior fascia of the urogenital diaphragm. Inferior fascia, superior fascia. Between these two we have a muscle called as the sphincter urethrae muscle. So this is called as the urogenital diaphragm. So this inferior fascia of the urogenital diaphragm, we call it as the perineal membrane. So this perineal membrane, and here lies the sphincter urethrae, and this is the superior fascia of the urogenital diaphragm, and over that above is the Colles fascia. So Colles fascia, perineal membrane, sphincter urethrae, and then you have the superior fascia of the urogenital diaphragm. So these are the layers we have, and in between these three layers we have pouches. So between the Colles fascia and the superficial and the perineal membrane, we have a space called as the superficial perineal space, and between the perineal membrane, also called as the inferior fascia of urogenital diaphragm, and the superior fascia of the urogenital diaphragm, we have a space called as the deep perineal space, where we have the muscle called as the sphincter urethrae. So these, keep it in mind, these layers. The first layer I have told you, this is the Colles fascia, and deeply you have this fascia is called as the inferior fascia of the urogenital diaphragm. This is called as the perineal membrane, also called as the perineal membrane. So this forms between the Colles fascia and the perineal membrane. This space is called as the superficial perineal space. So the contents of the superficial perineal space are main content is the urethra, root of the penis with the urethra, and the muscles we see here are this is the bulbospongiosus muscle. This muscle is the bulbospongiosus, and this is the ischiocavernosus muscle. So this is the bulbospongiosus and ischiocavernosus, and we have, these are the superficial transverse muscle which are going horizontally. They are the superficial transverse muscle. These three are present as the content of the superficial perineal pouch. And the other contents are, if you observe the nerves, you can see the nerves here going along with the ischiocavernosus muscle. The nerve is the, you know that pudendal nerve continues from the lesser sciatic foramen through the pudendal canal, and from here one branch is the inferior rectal nerve, and if you further come out here, this nerve also gives rise to the perineal branch. This perineal branch supplies the muscles of the superficial perineal pouch, and not only that, posterior scrotal nerve it will give, and if further it gives rise to the continuous as the nerve of the penis. So nerve of the penis, and along with the nerve we have vessels also here, that is the continuation of the internal pudendal artery. So internal pudendal artery also, it gives, first branch is given in the ischiorectal fossa. That nerve is called as inferior rectal nerve. If you pass into the urogenital diaphragm, it gives branches called as the that posterior scrotal vessels, and then it also gives rise to the perineal branch and continue as the artery of the penis. This artery of the penis gives rise to the 4 branches here. See, you can see branches called as the, because the urethra is piercing the bulbous spongiosum, it is supplied by the urethral artery, and also called as the artery of the bulb, artery of the penis, deep artery of the penis, and continue as the dorsal artery of the penis. So these are the branches of the internal pudendal artery and the perineal nerve on the lateral side of the urogenital triangle. So these are the branches here, and other contents are the, you know that if it is in the bulbourethral glands also will be seen in the superficial perineal space. So this is the perineal membrane here. So this is about, and if you take out this perineal membrane, we go into the deep perineal space. If you take out the perineal membrane, rupture this one, we will go into the deep perineal space. There lies the muscle called as the sphincter urethrae. So sphincter urethrae will be seen deep to that. So this space where I have passed my probe, this is a deep perineal pouch. And this is about the superficial perineal pouch and the deep perineal pouch. And if you observe here, this superficial, I told you in the beginning that we have 3 layers, this Colles fascia, and then perineal membrane, and then we have the another layer called as the superior fascia of the erogenous diaphragm. All the 3 are fixed in the posterior border. Here all the 3 layers are fixed, and all the 3 layers are fixed on the lateral side also to the ischial conjoint ischiopubic rami. On the anterior side, only these 2 layers, perineal membrane and the superficial erogenous diaphragm, only they are fused here. But whereas the Colles fascia is continuous above, so there is a gap. If there is any rupture of the urine, rupture of the urethra, the urine will be passing into the superficial perineal pouch and continues above, deep to the fascia of the scrotum, deep to the fascia of the penis, and deep to the fascia of the anterior abdominal. So the urine can be passed towards the abdomen when there is rupture of the urethra in the superficial perineal pouch. So that means there is a gap between the Colles fascia and the inferior fascia of the urogenital diaphragm. So this is about this superficial fascia, superficial pouch and deep perineal pouch in the urogenital diaphragm.